Hello everyone, it's me Dr. Ayaz Ahmed, working as the aesthetic dermatologist. So today I will discuss remaining part of melanoma. The name of topic is clinical features of melanoma. So within clinical features, I will first discuss clinical examination of melanoma. The clinical examination requires ABCDE algorithm. This ABCDE algorithm is needed to examine the lesion of melanoma. Here A stands for asymmetry. As you know that melanoma has a symmetrical lesion. B stands for border, which is usually irregular in melanoma. C for color. There the color variation, which I have already discussed in my previous lecture. D for diameter, which is usually greater than 6 millimeter, and E for evolution, that is new lesion or evolved. So these are the clinical features of melanoma. Pattern recognition. Our brain recognizes any image due to having cognitive strategy. When a dermatologist sees melanoma, image of melanoma is built in our brain. So whenever there is a change in melanoma, this new change can easily be picked up by a dermatologist due to having image of melanoma already in his brain. So those who see more melanoma can easily recognize new change in melanoma. Intra-individual comparative analysis or ugly duckling sign. It's the ability of our brain to note any change that is different and does not fit in its environment. For example, nerves which differ from other nerves in other individual need more attention and considered as a major sign nowadays by a dermatologist. This new change by a nervous is considered as ugly duckling sign. Dynamic analysis. Nerves grow and change very slowly, mainly in the first decades of life, while melanoma grow and change very faster. Assess any dynamic growth or change in size or change in shape in a pre-existing pigmentary lesion or any growing lesion or any new growth is important criteria for suspecting melanoma. Diagnostic tool. Dermoscopy, it's a simple non-invasive method. It increases sensitivity by 10 to 27 percentage, although it is not a reliable diagnostic tool. Moreover, computerized dermoscopy device, it's a very useful in a dynamic analysis, especially in atypical nevus. Reflectance confocal microscopy. In this technique, laser is applied to obtain top layer of skin. It produces horizontal section at histopathology resolution. It is needed for differentiation of a benign versus malignant melanocytic versus non-melanocytic lesion. Differential of melanoma. Melanoma can be differentiated from benign nevus or benign nevi, which is also known as the common mole, atypical nevi, basal cell carcinoma, squamous cell carcinoma, seborrheic keratosis, Merkel cell carcinoma, dermatofibroma, and lentigo maligna. All these conditions are kept in differential of melanoma. Presentation. Now there are common five situations. I will discuss one by one. Number first is the situation number 1. It is also called the atypical nevus or superficial spreading melanoma. It's the most common melanoma. It accounts for 60 to 70 percentage of cases. It's a flat and irregular macule-like. It has a shades of brown, black, gray, and red pigmented area. Differentials are atypical nevus or dysplastic nevus. This is a picture of situation number 1. Here melanoma number in A picture, you can see It's a small with irregular border. In second picture B, the shape changes. In third picture, shape and color also changes with irregular border. In fourth picture, the shape color changes. This is actually a situation number 1. In situation number 2, it is also called as a pigmented or a red nodular melanoma. It's a less common. It accounts for 10 to 20% of cases of melanoma. These are regular symmetrical elevated dome shaped uh, color range from dark to brown to red. It's the fastest growing and thick tumor. Ulceration and bleeding are common. This picture describes a nodular type of melanoma. You can see it's a dome shaped structure with a round symmetrical border. Moreover, here somewhat symmetry change, but structure is thick and very hard in structure. Situation number 3. This is also called the lentigo of face in adultery. Another name for it is lentigo maligna melanoma. It's a common in sun exposed part, especially the face, neck, and forearm. It's a flat brown color with irregular slow growing lesion. It has a very long radical growth. Or in other words, you can say that the tumorous cells grow along the basal cell line. It's a subtype of LMM. You can see this type of melanoma is common in adult people and sun exposed area. Now situation number 4. It is also called as a pigmented stain on sole, or another name is the acral lentiginous melanoma. These are actually the light brown and pigmented macule-like dirty-like stain with indistinct border on the sole over 60 years of age. Common in black population, almost 60 to 72% of cases are seen in black population. It corresponds to ALM subtypes. Nodule and ulcer develop in later stages. This is a pigment-like structure present in the peat area. Mostly it is also seen in adult people. Situation number 5, that is pigmentation on the nail area or sublingual melanoma. In white people it accounts for 2 to 3%, but it's higher in black population. Brown to black linear discoloration in nail. Differentials are onychomycosis, paronychia nevus, and pyogenic granuloma. This is a picture of sublingual melanoma. You can see linear line of deep cherry red color seen on the nail area. Other clinical situation which include pigmented lesion on vulva or mouth, melanoma from congenital nevus. It's a less than 5%. Presentation is a irregular macular pigmentation. Ulceration and bleeding are common in later stages. Prognosis is very poor. Melanoma from congenital nevus represents as a verrucous and lobulated surface. It's deeper in dermis and subcutaneous fat, making diagnosis very difficult. Ocular melanoma. Ocular melanoma arises from melanocytes in conjunctival membrane and uveal tract of eye. It mostly affects choroidal part. Around 83% of cases are seen in choroidal part. Presentation include asymptomatic to visual disturbance and visual loss. So this is a picture of ocular melanoma. You can see this involvement of ocular melanoma in the choroidal part of eye. It may leads to blindness ultimately. Misleading clinical situation. There are some situation which misleads dermatologist. It includes a melanocytic melanoma. It's usually missed by the clinician. Presentation as an inflammatory lesion, sarcoma, angioma, or squamous cell carcinoma and basal cell carcinoma. hardly visible on sole is a warty or nodular lesion. This is a situation which is usually misled by the dermatologist. Regressive melanoma and malignant billow nevus and sinonasal melanoma. It is due to the inflammation leading to hide melanoma, usually visible as an irregular focus of hypopigmentation. In malignant nevus, it is a rapid pigmentary change in color of a common nevus. Moreover, sinonasal melanoma represents area presentation area include epistasis and nasal obstruction. Extension into orbit, brain, cranial nerve leads to poor prognosis. Thank you very much. Stay connected and subscribe my YouTube channel.